Good morning to you. So the president says we are entering a new phase in the fight against the spread of COVID-19. In your view, what does the president mean exactly?
He raised quite a number of very significant things, issues, because on the one hand, there's no doubt that there are more people who will test positive, and the only problem so far has been that people are not being tested. Everyone is being advised to stay at home if you develop symptoms, try and boost your immune system until, of course, the situation gets fairly serious. So it's really the most obvious thing to do, to test as many people as we can test. The question, of course, is whether we have the capacity to do so. And this is not, again, another sort of box-ticking exercise.
Of huge interest for me, Vuyo, was that the president makes this announcement on the drastic measures that are now going to come in. That includes the expansion of the testing sites and actually going into people's homes. He announces this on the back of 3 people now having been declared dead as a direct result of COVID-19, but also 2 people confirmed to have been infected by this virus. That is in Khayelitsha and in Alex. In Alex, you actually even have a further 5 people who have now been put into quarantine as a result of their possible contact with that positive person. That's a big worry for government, isn't it?
It is, because remember, once you get to the stage where you can no longer say it's only the people who were on flights abroad or to and from overseas or outside the country that have been infected, then that's a very critical stage. That's where you now have to really do everything you can to manage, the spread of this pandemic, because it then tells you that we're beginning to infect one another at homes or in public places in more so than had ever been the case before. That's when you jack up your systems. You literally go for broke. But you see, the problem here is that this is happening at about the same time we're suddenly realizing, that we're sitting with more problems than we thought we had. We've suddenly discovered that, our people use taxis, that are filled to capacity. Yeah. We've suddenly discovered that the poor, the old, the sick, and the infirm don't think the way we think. All these discoveries are things, we should have known a long time ago. And whatever planning we may have been contemplating, as soon as this pandemic struck, should have actually taken those things into account and taken the very real, practical experiences, everyday experiences of people. It's no use really to condemn the poor right now, to say, why are they not social distancing? Sure. It's not a surprise. It's not anything new that people go to shop to pay points and go back home without having received their money. So in our planning, those things should have been factored in. It's not new that some among our Defense Force and SAPS members do carry themselves in ways that we shouldn't appreciate as a democracy, given where we are coming from. And all those things should have been proactively sort of factored in or taken account of.
In the midst of the criticism that you're leveling against government for their poor planning, frankly, around how to deal with this issue when it comes to densely populated areas for you, I want to extend it a bit and talk about the WHO, which has come also under criticism from some people who've written opinion pieces that why do they seem to think that a one-size-fits-all is going to work in countries such as South Africa, which have very high inequalities, and much further than the criticism is them not having anything on their website, we are told, that talks to the technicalities or any technical advice that they ought to give to countries like South Africa in areas that are densely populated in as far as the so-called social distancing is concerned. And I'm starting to wonder whether our government, whether we shouldn't take our own initiative in saying perhaps we need a rethink about this whole exercise of social distancing, particularly in townships and informal settlements.
Well, look, I mean, in all fairness to both, the government, the South African government, and the World Health Organization, this is something that is bigger, than all of us. And a lot of the things people are learning, as we go along. Look at the recent discoveries, for example, about how this virus gets transmitted. Some of the things have only been discovered now. The airborne factor, for example. So these things are very complicated. But on the other hand, people must take responsibility for not acting proactively or for not dealing with some of the, socio-economic factors that make the spread of this virus less manageable than would have been the case ordinarily had we taken care of our economies, had we taken care of the poor, the old, the sick, and the infirm long before this virus struck. So it doesn't remove that fact. But it also puts a great deal of responsibility on each and every one of us to do our bits, from our respective little corners. It's no point condemning the poor, saying, these people must be shamboked, or beaten up, simply because we're now suddenly discovering that they could be carriers of this virus, and that is now suddenly going to affect us. We should indeed go back and look at some of the things we have done or allowed to happen, that have brought us where we are, where simple things that can help us a great deal cannot be implemented precisely because this is how people have conducted their lives. We kept the poor outside. To expect them to think differently or to behave differently now is really too much of an ask. But that's not, of course, to say that we should then allow the situation to fester. But I think there are more humane and more urgent things that we need to do way beyond that, what we are doing currently. And by the way, that goes for politicians as well. I was having a conversation with someone yesterday about the opposition. They met with the president. They agree with the president about what needs to be done. But what has each and every one of them done proactively on the ground, speaking to their members, speaking to their followers, supporters, to broader South Africa about what needs to be done? I bet you, if you have an election tomorrow, those people are going to stop at nothing, when they want your votes. How about applying the same, level of commitment, all those energies to actually, making their own contribution in fighting this pandemic? So the point I'm making, I'm not condemning everybody, is to say each and every one of us really has a role, and condemning one another is not going to help.
Indeed. Vuyomvogo, thank you very much. It's time for us to all play a part, and must remember that we all have families that we go back to.